All right, welcome wherever you're coming from, whether you're here on the Zoom call or you're streaming in live through Facebook, or you're hearing us on the phone, wherever you're hearing us. Today, we have a awesome guest, Dr. Lynnette Hendrickson, who is going to be talking to us about their experience with StemWave. They integrated it into their practice not too long ago, and seemingly through the grapevine, I have just heard about the amazing success that you've been having with the technology this far, from a clinical standpoint as well as just for your practice in general. And so I've been wowed by it. I've heard the stories. And what we're going to do today is dive a little bit deeper, go back to before you had StemWave, what it looked like, why you guys added it in the first place, how hard was the process, what are you guys using it for, and dive into all the nuances that people are so curious to learn about. And so without a further ado, welcome. How you doing this morning?
Doing wonderful. And yourself?
I am also doing wonderful. I'm doing better that we're here now. We're live. I'm caffeinated. I'm feeling good. I hope everybody else is as well. So why don't we just kick it off right here? I'd love if you could just give maybe a little bit of a background on yourself. How long have you been in practice? Tell everybody where your practice is located, what you guys have focused on, and you guys have set up over there, just so everybody has context. And you can see the beautiful picture of your family behind you as well. So, fill everybody in.
Well, we've been in practice for 28 years and we've had pretty much a family practice. I practiced part-time when our kids were little and then went to full-time when they got bigger. And I actually specialize in pediatrics and pregnancy. So we see all ages and stages in our practice.
Okay, wow. Okay, and what is the size of the practice? How does the staff look? Give us a rundown.
Yeah, we have got, I want to say three and a half staff. We have two full-time people that work the front desk. We have a part-timer that kind of floats and helps with therapies. And then we have one gal who works part-time who's just designated to filing insurance.
And you guys have been in practice for 28 years, right? So like, things obviously must be going pretty well. You guys have it figured out. You know exactly what you're doing. You know what problems to solve. What changed in the recent times that interested you guys in adding a technology like StemWave?
Well, I would say that honestly, when our son had an injury before he went to the World Championships, StemWave was like a game changer for him. So that's what got us interested in it. But I don't think we had any idea the impact it would have on our practice, not just with being able to help patients that we normally couldn't help, but financially, it definitely bridged a gap because as time's gone on, insurance just keeps on covering less and less. And when the economy gets bad, it's a struggle for people that are trying to put food on their table to literally come up with cash out of their pocket to go get some of the things that they really need, but maybe can't justify. And so I really didn't have any idea of what the impact it had financially in our practice till I actually had my my insurance gal run the numbers for me. So it started out as an interest in a therapy that could help people with soft tissue injuries and musculoskeletal problems. That chiropractic, it doesn't hurt, it helps with alignment, but when you're dealing with torn tissue, you need more than that. And a lot of times those people we'd have to send out either to an orthopedic doctor or possibly physical therapy, or, they'd need surgery or shots and things like that, or medications.
Hmm. So I want to double click on something you mentioned there, which is, did you mention that your introduction to the technology was actually through your son?
Yes.
So go through that. What happened there? How was the introduction through your son?
Well, he's been a wrestler since he was 5, and he was at the Air Force Academy in his last year, and he's had kind of a nagging shoulder injury. He had a torn AC ligament, and it just flares up every now and again. He was getting ready to go to the World Championships and represent Team USA, and his shoulder was bothering him. And I had actually seen something about shockwave therapy before I even knew that this company existed. And I said, hey, check and see if your chiropractor or the Olympic Training Center has it. And they both did. And he was just like, wow, mom, like one treatment. And he said, my range of motion was great and the pain was gone. He said, I could feel it working deep down right where the injury was. And so I asked him, see what machine that is that your chiropractor has. And it was the StemWave. And so then I
Wow.
reached to you guys. And then during the world championships, in the championship match, he tore his MCL ligament in his knee. And I felt so bad for him. I mean, he did win the match. He's running around with the flag and he's limping. And he said, I wish I could have like enjoyed and savored that moment. But all I could think about was, what did I do to my knee? And am I going to have a senior season? And so I can honestly, without hesitation, say that he would not be wrestling right now, today, without StemWave, because by the end of the year, after the NCAAs and into the Olympic trials, he had two knees, a shoulder, a thumb, a wrist, and an ankle that were all injured. And we had to kind of alternate. And the problem was at the academy, he didn't have access to the StemWave because he didn't have windows of time to leave the base and go get it. So, that I think he would have been better a lot faster if he could have gotten the number of treatments he really needed with it. But it was
Wow.
a danger for sure.
That's an incredible story. And, in a sense, it's a blessing in disguise because it introduced you and your community to the technology, which have now been able to help and serve so many different people in, some variety of a similar condition to what your son was dealing with. And so you heard about it through this crazy scenario and you said, you know what, I've got to look into this. I want to try the device that helped my son to the extent that he was able to go compete at a global scale on behalf of the United States. You looked into it, you found out it was us, you called us, you spoke to our team, and you said, listen, what did you say to us? Were you just like, what happened here? Like, could you explain it to me? Like, what was the conversation like?
I was just like, I was honestly wowed. And of course I'm that type of person. I'm cup is half full and I'm optimistic and I'm like jumping all in. And so I talked to my husband and he goes, how much is it? He's like, does insurance cover it? And he's like, no, we're not spending that much money on a piece of equipment that people have to pay for out of pocket when they're struggling right now in this economy just to pay for chiropractic. And so here was the kicker. Honey, there's a 90-day money back guarantee. He's like, okay, we'll try it. He was like, okay, we'll try it. And I think that made me happy because I would have jumped in either way because I just was so impressed by the technology and I had been looking into it a little bit myself and I thought, wow, this is incredible. If this does what they say it does, then that's going to be just, like I said, a game changer for so many people. And it's not just athletes. We're talking about athletes,
Yeah.
right? But I have to tell you, when we got that machine in our office, the excitement and the energy was so contagious because we were just trying it out on existing patients. We were just picking people that had shoulder problems, knee problems. We had a guy come in who slammed his thumb in between a railroad tie and something, and he wanted to know if it was fractured. And I just remember, hey, let's try this stem wave on it, after we x-rayed and it wasn't. And literally he went from not being able to move his finger to moving his thumb like right away. And he was like, wow. And like people were just kind of in shock. You'd see them come out of that room and they'd have this look on their face like, oh my gosh, that feels so much better. And then the other patients are like, what are they doing in there? Because it made a funny noise. And Todd was kind of concerned, should we move that to the other side of the office? Because it's kind of loud. I think it's freaking people out a little bit. But what it did is it just kind of piqued their curiosity. And everybody wanted to know what this new machine was. And like I said, we did everything from sports injuries, with youth and kids and college age to shoulder problems, with middle-aged men and knee problems with 70-year-old ladies. And it didn't matter who it was. Everybody was just like, wow, this is incredible. This is unbelievable was the word that came out. It's unbelievable, that I could feel this much better with just one treatment. Because some of them, they've had these problems for decades, you know. So the excitement and the energy, and I'd have to say, it's not gone, because we still are constantly getting a flow of new people. And I was honestly surprised because we started off selling packages. And I thought, people are going to do the trial and maybe they'll get one or two. And they're like, nope, I'll take a package. I'll take a package, right away, same visit. So that
Wow.
is then they're going to get better. I mean, you're going to get better from one treatment, but you're going to get, you know, healing if you stay the duration and maximize what benefits StemWave can do. So,
So you go and you speak to your husband, and he says, "Is it covered by insurance?" You say, "No." He says, "Is it expensive?" You said, "Yeah." Okay, well, that's like a double no from me. And then he said, "Well, they have this offer. You can try it out at no cost. They told me if it works, I can keep it. If it doesn't, I don't have to." And then you said, "You know what? Let's just wing it." You gave it a shot. You brought it in, and you started seeing what we call, by the way, internally, is like the wow factor, which is most offices, it's not like they've never seen that with patients before. In fact, if you've been in practice for 28 years, of course you've seen the wow factor many times before. The difference is it goes from once a week or once a month or once a quarter or once a year to a daily occurrence.
mhm.
And all of a sudden, you start seeing that and you start expecting to see it. And what we see is it just lights up the staff and just rejuvenates, exactly what you got into practice for, which is changing lives and helping patients. And so bringing that wow factor daily into the practice. I'm curious, like, how has that changed the energy that you have with how you apply and how your staff applies, just showing up on a daily basis and seeing patients?
I have to say it is exciting because even some of our staff has had issues that they have seen great benefits. One of them had a congenital deformity in her hip and she's had multiple surgeries and she has pain every day and she doesn't anymore. And so I think it boosts everybody's, not only their morale, but their confidence because have a really, really acute patient walk through the door. We know how powerful chiropractic is, and keeping your nervous system functioning at its optimum is just so important for overall health. But when you've got other joints, and it does include the spine, because when we have really acute patients with spinal issues, we will do stem wave on their back or neck, and almost every single time it will just kind of decrease the intensity of the pain, take some of the sharpness out. And so it is just such a wonderful tool to know that you have it available when you have that athlete come in and it's like right before the big game and they just hurt something. You're like, oh, thank goodness. We can get them back so much faster with this technology. And, with all the other modalities that we've had in our office, I mean, they're good, but this is like awesome, on the scale of good, better, best. It's like, it's a game changer and a
Mhm.
winner. And so it just helps me um feel more confident that I can help more people than I could have helped before. They're
Yeah,
like,
the thing we consistently hear on what you're saying is it instills confidence. And the reason is because it's so consistent and predictable just with the types of cases that you're seeing and the outcomes that you're expecting. So why don't we touch on that real quick? Like what types of cases just, because a lot of people who come to these calls and are considering our technology, they don't even really know like what they could be using it for or what they should be using it for and like what type of outcomes they should be expecting. They're like, okay, well, you get the wow factor, but like, how many treatments? What are you seeing? So like what types of cases are you commonly seeing, and over what period of time are you seeing what types of outcomes?
So I would say probably the two biggest ones would have to be shoulders and knees. People with repetitive stress injuries, tendonitis, bursitis, or I don't know what kind of itis it is. I just can't move my arm. We had a guy who was a professional football player, and he had a bad shoulder. And so he basically said, I can't pull my bow back to go hunting. I need to chop wood and I can't do any of these things because, my shoulder hurts so bad. And I'm thinking, should I go get surgery on it? I don't want to really get any more shots in it. And so he had been in maybe 3 or 4 times. And he said, you know what? I am back doing all the things. He said, I can dig holes, I can chop wood, I'm hunting, I can pull my bow back now. And for him, it was like, I just got my life back, you know? And then we had another lady. She was the very first patient that we did this on, and she had a bad knee. And I mean, it was so bad that her whole leg was swollen from the knee down to the ankles. She said, I've got cankles. And then the other knee had been replaced and it wasn't quite as bad. Well, we treated both knees. And literally after the first visit, she came back and she said, look, you can see my ankle bone. And she was pointing and flexing her foot. And Todd and I looked at each other like, we didn't do her ankle. We just did her knee. And so it was like, wow. And so she did a series of treatments and she was a little bit harder case. So I would say it was a couple months for her. I'd say 10 or 12 visits, but she was able to start walking and exercising. And so she had put on some weight. And so for her, again, I got my life back. I can do all these things. And then, like I said, these strange injuries, like the guy who hurt his thumb, people with problems with their wrists. I have a gymnast that I treat, and she came in actually, was an auto accident patient. And, she does a lot of tumbling with cheer mainly, and her wrists were just killing her. And she's only 12. So you hate to think of that outcome in 20, 30 years, but it helped her wrists. Also had some people with, numbness in their feet, like neuropathy and plantar fasciitis. We did it for those people. It helped them. Again, they feel relief in one treatment, but they do the best. If they do, I'd say 6 to 8 is the average. Now, obviously, some people need less. Some of your, more acute people need more. But then another big one is the hip socket itself. I had a patient with fibromyalgia, and any doctor out there knows that that is the toughest patient to treat typically. They're sensitive to things. They don't always respond the same way, and some of them identify with the disease. And so I don't know how much they want to get better. But anyhow, did about 5 treatments on her hip, and she told me she had not been able to lay on her side for a decade. And she
Wow.
stood up after the first treatment and she said, is it possible that it feels better already? I said, absolutely. And
You
so
know,
that's so exciting to me to be able to say that with confidence and know that that person is going to just experience something they haven't been able to experience with anything else.
what we like to say, and you tell me if this is directionally accurate, is we expect 80% improvement for 80% of patients 80% of the time. That's kind of the baseline. Like that's the bare minimum of what we should be expecting. And in a lot of cases, when you get really good at StemWave, that's like the floor of what really should be the case. And improvement in this case is measured by decrease in pain, decrease in inflammation, and an improvement in range of motion. For the most common conditions that we're seeing, you guys just heard Dr. Hendrickson talk about this: hands, shoulders, knees, elbows, feet, hips, low back. These are the most common things that we're able to see. And the way the technology is designed, like it contours over all these areas very easily. And as you start understanding what the technology is capable of, you start understanding the versatility. And so, an area that I really want to explore with you, Dr. Hendrickson, is, what I'm hearing is you guys have had a practice for 28 years. And you mentioned early in the call that there were a lot of cases you guys were referring out that you weren't really, they weren't really your focus. And it sounds like more of those were the extremity cases, the knee cases, the joint cases. Those just weren't cases you guys would want to normally keep on. Now that you guys are keeping that on, how has that changed the type of patient and the type of cases that you guys are able to handle? Like, has it opened up the market of who you can serve?
Absolutely. And I would also say this. So we have people that come just for StemWave that aren't existing patients. And I would tell you, a person with a shoulder problem usually has a neck problem. A person with a knee problem usually has a hip or a back problem. And so it has allowed us to not only bring those patients in for StemWave, but they've come in for chiropractic care. And
Wow.
yeah, so seriously, that's been really nice because you don't want to just treat a knee if they also have a back problem or a neck problem. You want to make sure that you treat the whole spine so that they can just be the best version of themselves. So we definitely have seen a huge uptake in new people coming not just for StemWave, but also chiropractic. But then existing chiropractic patients, then they all of a sudden say, oh, well, you know what? My husband's got a really bad shoulder problem, and I think we'll have him come in and try this. Or my son just hurt his knee in soccer or whatever. So it has definitely opened that up. And modalities, we have all the things, all the other things, ultrasound and laser and EMS and all of that stuff. And it's great, but it wasn't always enough. It helps, but it didn't completely alleviate the issues. And so not having to refer people out, and people tell us all the time, I've got a really bad knee, I'm bone on bone, but I don't want surgery, or I don't have time for surgery
Mm.
right now, or whatever. And so that's been really nice to be able to help those types of people.
Yeah, I think something that most practice owners fail to realize is that, let's say you're a chiropractic office and, like you've been in business for 28 years. What most chiropractic offices don't realize is that they actually cater to a painfully narrow demographic of patients. And in fact, if you look at the statistics, only less than 11% of the US population has been to a chiropractor in the last 5 years. And so it's like, if you're a or, even if you're a physical therapist and you're on the call and you're thinking it's different, the stats are even worse for physical therapists. In fact, I believe the stats are less than 9% are actually ones who take physical therapy services 1% of the options. So, like, that's a very painfully narrow demographic of patients that you can help, especially in a world where more than 50% of the US population is suffering from some form of a chronic or acute musculoskeletal condition. And so, what we see that StemWave does, and what I'm hearing that it's done for you, is it just opens up the market of who you're actually able to serve and who you're actually able to help, right? You go from, a few patients that you can help to a family that you can help to this, to that, to now you're in the grocery store and the person that you saw who was unable to push their cart, or the person who went to go pick something up but they couldn't do it and you watch them groan just a little bit, you have a solution for them that's almost better than anything else in the community that they could have. You now have that, and it really puts the power into your hands as a practice owner. So I'm getting a sense that that's the feeling that you've had.
Oh, 100%. And you know what the best thing is? We don't have at all with this. This is, no strings. It's like, it's an amazing asset to be able to add something to your practice that doesn't, make you have all the extra paperwork and red tape that a lot of things do when you're dealing with insurance.
But transparently, that's a concern for a lot of practices, because I can't tell you the number of practices that call us on the phone. And on one hand, they say, is it covered by insurance? We tell them no. And they say, well, I know I know insurance is death by a thousand cuts, but if it's not covered by insurance, how are my patients going to pay for it? So what has been your experience there?
You know what? It is amazing when something works, people will find a way to pay for it. People that we never dreamed, like some of our elderly patients or patients that do have Medicare or insurance. I mean, a lot of times they don't have many other options. If they've tried chiropractic and they've tried PT, their next option is probably going to be an orthopedic surgeon. And some of these problems are not surgical fixes. When you're talking repetitive stress, tendonitis, bursitis, that's not something that surgery is going to fix. So being able to create your own stem cells to heal damaged tissue, I mean, that's the way God designed us to heal. And
Yeah.
so that just gives us more of what we already have inside of us to get better. And
Yeah,
so,
and it's unfortunate. It's if you think about the options that uh, most communities and most patients who are suffering from pain, right? Like from the office workers to the elderly to the athlete to everybody that you've named, they're really faced with three options, right? They can either they can go get a surgery, which, as many of us know, is oftentimes unnecessary and even inappropriate in many cases. But guess what? A surgeon's job is to do surgery, right?
Mhm.
Or alternatively, they can go get pain medication, which I'm not going to go down the rabbit hole of why that is an obvious issue for America. Um, or they can do nothing at all, which in fact is what most people end up doing is they do nothing at all. And therein lies the opportunity of patients that you can actually help and you can actually serve in your market. And what you said was such a great thing, which was when you actually provide a solution for somebody, money is never the problem. This is what we've seen. We've integrated this technology now into 450 practices. And one of my major concerns when we launched this was it's not covered by insurance. Is that going to be an issue for patients? And what we saw time and time again was the exact opposite of that. In fact, patients were absolutely willing to pay for it, even if they hadn't paid for things like this in the past. It was not a problem for them, and it like contrary to the belief of most doctors, it just worked, and they were willing to pay for it, which was a great benefit for them because insurance, like I said, it's been death by a thousand cuts. They don't like insurance. Nobody likes insurance. And insurance doesn't tend to cover things that work, do they? Right. So, um, yeah.
well,
So
but
I want to.
one thing that I don't even know if I've shared this, but a lot of our auto accident patients' insurance has been paying for this.
Mm,
There's one provider in the area, and if you're in Kansas, Farm Bureau doesn't want to pay for anything. But the rest of them, they must see the value in it because it definitely helps those patients get better quicker. It's a lot
hmm
faster therapy than the other options we have, and the results are just better. But then people can use care credit. People
Yep.
also use their health savings account. So, if your staff is well educated, they can definitely, provide those other options to patients. And patients don't always think about that. They're like,
Yeah.
oh, yeah, I do have an HSA.
So let's kind of you mentioned something earlier in the call that I want to explore a little bit, which is, I mean, you guys have had a practice for quite some time. You've tried a lot of different technologies. You said you tried ultrasound. You said you tried laser, and it's not that you tried it and it didn't work. It worked, but it just wasn't enough. So talk to me about what you guys experienced with those other technologies. We'll categorize them as the other technologies. Um, Tell me about that. Like, what was your experience with them? How long were you using them? And what's the major difference between them and something like StemWave?
I mean, we started from the very beginning using muscle stem and ultrasound, and then later on we added a laser. And they're good. They definitely help, but not in every situation is that enough. You know,
Mm,
when somebody's really, really hurt and really, really needing to get healed up quickly, it would take so much longer using those other therapies. You know, it,
mm,
they're good. I'm not going to say they're bad. They're good.
yeah.
There's like good, better, best. This is best. It's
And
It,
how was your confidence with those technologies? Because what I'm hearing is like you liked them, but like, would you recommend them to a lot of patients? Like, were they priced lower than StemWave is? Like, how did it work out?
yeah, they're definitely priced less than StemWave. I would say they're more labor intensive as far as the time it takes to hook the patient up and the time for the patient to sit on the therapy and then unhook them, I'd say they were a lot more labor intensive. Now, this is a hands-on therapy. What I love about it is I love talking to the patient while I'm doing it. And I love, you learn things you maybe didn't know before and you figure things out that allows you to help them better, even from a chiropractic standpoint.
Mhm.
It's a great time to educate patients because I mean, it is just one-on-one time. And it doesn't take a long time to do the therapy, but it's long enough that you're not
Yeah.
focusing on anything else. And so but when you're talking with patients, what usually happens is they start thinking of family members could also be benefited by the therapy.
Mm.
Well, I didn't think that you could, do this for plantar fasciitis or, my grandma's got diabetic neuropathy, and
Mm.
obviously we don't make claims to treat, we make claims to heal damaged tissue, and that often results in decreased pain, decreased inflammation, and sometimes decreased or getting rid of symptoms.
Yeah, and I'll tell you, a lot of what we've seen as well totally aligns with that, right? In fact, probably about 70% of the offices that we've worked with were in a similar situation as you, which is they either use laser, maybe they use ultrasound, maybe they use radial technology, whatever it is, they used something else. The problem was this is what they experienced: inconsistent results. They just sometimes it worked really, really well, other times it didn't work so well. Second, it worked well, but it often took so many visits that the patients just wouldn't comply with the care plans. And as a result of those two things, they ended up pricing the service so low that it just became a question of if it was even worth it to do this service. Um, and so those are two completely polar opposite worlds where on one hand you have a technology you're not confident in, you don't want to price at a value, and you're really unsure if you can deliver consistent predictable results to many cases. On the other hand, with StemWave, you can consistently, reliably, and predictably deliver 80% improvement 80% of the time to 80% of patients within a matter of, anywhere from 6 to 12 visits, depending on the case. So these are two polar opposite different worlds that we're living in. And it really sounds like it's changed the game for you. And so I'm really excited to hear that. And, kind of shifting gears a little bit, like talk to us a little bit about you, how it shifted the business side of things for you. Like, has this had enough of an impact? And don't feel obligated to cover anything you don't feel comfortable with, but like, has this been enough of an impact for you and your husband to look at each other and say, this was a really good investment?
Oh yeah. Yeah. I'm not a honey, I told you so kind of person, but he was like, you were right. This was a good idea. I mean, we figured out right away that we made the, and I can say, um, just in general, we have had three of our biggest months financially, and we're into the fourth one that we've had probably since COVID. And I really didn't know what an impact it made. I mean, you see the money in the bank and you're just like, oh, wow, this is great. So it does take a while, I think, to see the true impact. But I had my office manager kind of run the numbers for me because I said, I'm just curious, how much revenue have we had? And we've had our machine, I want to say about 15 months, maybe 16, because we got it in the summer of 2023. And our revenue from that has been $153,000.
Wow.
And I was like, oh, oh my goodness. That's incredible. And even if you take out, what we pay. I mean, that would have paid for the machine over twice, right? And the marketing. But even if you just take out, the payments, and we just were like, we should probably start getting this thing. We could get this thing paid off. We just need to start bumping the payments up. But even if you take out our costs for the supplies and the payments on the machine so far, I'd say we still are up, you know, 125,000 or 120,000 for the year. So, do the math, 10 grand a month ish,
Yeah,
you
and
know.
what people don't realize about that, by the way, just to go a level deeper on this math, is that it's one of the most efficient modalities and one of the most profitable modalities you can actually use, right? How long do your treatments take?
Oh, the first one we spend time with the patient,
Hmm.
I would say closer to 10 minutes because you're talking half of that time, maybe even 15 if you're chatty like I am. But the actual treatments take, I would say, 5 minutes. You
Yeah,
know,
right. Like conservatively, you can, if you're up and running really fast, conservatively, you can do a minimum of four of these an hour.
oh, absolutely, absolutely. And we've had to start being really careful because our STEM wave has been so busy that we got two people sitting on the couch waiting. We got one in there. We got one down the hall.
Like, how many are you guys doing per hour, do you think?
Oh my gosh. I'd say on the average, at least one per hour, but sometimes
Mhm.
we're only in the office 2 to 6. And so we might have
Mm,
four in 1 hour, but it's getting to the point to where we had to make a new column for scheduling where we had to put they turn green and it has a W by their name saying this is a STEM wave person so that we know that we're not going to get too bogged down with that many
yeah.
people. But the nice
Yeah.
thing,
And
people get well and they phase out, then you got new people phasing in, right? So the people that were getting wave back when we first got it, they're not getting it anymore. They may come back once in a while and get a treatment here or there, but it's a whole new wave of people every probably 6 to 8 weeks that phase in and phase out.
that's the math, by the way, that we try and have offices do before they add it, which is, a big concern that a lot of people have with adding this technology is, well, I've added technology in the past. It's been a huge learning curve. Not only was it a huge learning curve, but it was a huge time investment. And the math we try and do to them to show them is like, listen, even if you only did this for an hour a week at $150 a session, you're doing $600 an hour, right? There's nothing else you're going to be doing in a chiropractic or physical therapy or regenerative medicine clinic, maybe, that's going to be $600 an hour. That's just not going to be the case. So it's one of the most profitable per minute, per hour, per week, per month modalities that you can have in your office. But to that point that I was just bringing up, how hard was it to go from I'm interested in StemWave because my son used it to I can successfully use this with my patient? Like, what was the learning curve like for you?
It was pretty short for me. Like I said, because I know, and here was what Wyatt said to me. He said, "Mom, I've tried everything. We've done chiropractic. We have done, the trainers worked on me. I've done ultrasound. I've done dry needling. I've done massage. I've done cupping. I've done muscle stim. I've done laser. I've done it all." And he said, nothing worked like this stem wave. And so, when you hear those words, I can obviously trust my son. Plus, I know what he's done because we had to pay for some of it. And so to have something that could literally change that many people's health and lives was just like, we got to have this. I mean, I'm going to find a way to talk you into it with Todd, one way or the other. And now he's like the biggest, advocate of it. And he's recommending it to a lot more patients than he was even before, because like we even have people with neck and back issues and to be able to use that and loosen those muscles up also makes our job easier, and we get better results by having it in the practice.
Wow. So
It's
what we'll do, it's what?
it sets us apart because people are like, "Wow, why doesn't everybody else have this technology?" It's like,
It's
"Well, we
true.
don't know about it. I don't know. We like to stay on the cutting edge of things."
Exactly, and you have so in the last part of the call, really in the last, 5 to 10 minutes we have here, one of the things I love to do is just really take questions from the audience. And so if you're watching this on Facebook or Zoom or wherever you're watching this, you could just drop a question right into the chat. And I see we've already got a couple, so I'll tee them up for you and we'll walk right through them. But before I start teeing up those questions and just give these people a minute to throw some questions in, I'd love to ask you one final question, which
Sure.
is there's a lot of people who are so interested in helping more people. They are so interested in providing a service like this to their patients. They've seen what it can do, they've read the studies, they know what's possible, they know what can happen with this, but they're just nervous because they've never actually spent money like this. They've never made an investment like this into their clinic. They've never taken what they feel like is a leap of faith like this. And so, if you were sitting down side by side with someone who is on the edge of considering something like this, what wisdom or information would you offer them to help them come to terms with a decision on something like this?
Well, I would say, first of all, the research and the studies, the scientific evidence already proves that it's going to do what it says it's going to do. But I would say, I mean, if you dig deep, dig back to what made you go into your profession, whether you're a chiropractor or a physical therapist, there was something inside of you that felt like, okay, this is what I'm supposed to be doing. And it was daunting because it was a huge expense to go through school. It was a lot of time, it was money, and you had to take a leap of faith on that. This is no different. It's no different, but the main thing that you have in your favor is that you've already got the science and the research and the evidence and the testimonials. So it's just wrapping your own brain around it. I think in this economy, sometimes people get a poverty mentality and they think, oh, well, what if? And people aren't going to be able to afford it. And it's going to cost us money and all this other stuff. Well, what if you jump out in this and it's the best thing you ever did for your practice? I mean, we definitely have to make decisions like that every single day. And so, I mean, hands down, I recommend this to everybody because I do. It's just that amazing. It's not
I
a
think that's phenomenal wisdom. I think that's phenomenal wisdom. And the last, piece that I'll add to that, which is something you said earlier, which is, you had a chance to try this risk free. Like you might not be here and you might not have made that impact if we didn't have that, which by the way, for anybody here on the call, I'll talk about it at the end of the call before we wrap up. But we do have an offer where you can try the technology. If your practice qualifies, not every practice qualifies to be totally upfront and totally clear. Um, that you can try the technology in your office with your patients at absolutely no cost to you. And if you love it, you can end up like Dr. Hendrickson and the rest of the 450 practices that we work with, or you don't have to continue and you don't have to keep it. But literally 98% of practices have decided to keep it. And obviously there's a reason for that, which is mainly what Dr. Hendrickson talked about here today. So with that, let's jump into some of these questions. Some of them sometimes, by the way, are complicated. So I'm happy to jump in. I don't want to just like throw you on the spot and you have to answer all of them. So somebody said, I have a practice that focuses on pediatric patients. Is there a concern with using StemWave over growth plates? I'll let you comment on your experience and then I'll give the company standpoint on growth plates as a whole.
Yeah, and it's my understanding that we absolutely don't want to do any harm, and the reality is they don't know if it could be harmful or not, but there's a theory that it could be, so the best thing is to stay away from the growth plates. And I know a lot of injuries tend to be like one of my first kids, it was an elbow injury. And all I can say is you're still going to get benefits in the whole general area. You don't have to be right over, The injury kind of helps you localize and pinpoint it where the pain is, but you can be in that general area above the growth plate or below it, and you're still going to get benefits. But yes, that is definitely something that I think it's better to avoid the growth plates just because we don't really know. We don't want to do research and say, oh, yeah, by the way, it harms the growth plates. So,
Yeah, exactly. I mean, this was I'll say this. It was a bit of a bigger deal um, many years ago because of the lack of concern or because of the just the lack of understanding of what might be happening with growth plates. As it stands today, our company has changed our stance on it a little bit, which is, as you become a developing practitioner and understand more about the technology, we're actually less concerned about growth plates as a whole when you really understand the mechanism of action, which we'll get into. And if you have deeper questions on that, my general recommendation is to book a call with our team. And what they can share with you is they'll actually share with you our position statement just on growth plates as a whole. It used to be a contraindication. I would not say it's a contraindication at this point if you have a deep understanding of the technology. Yeah. So happy to dive into that. The next question is how does the mechanism of action work, and is there off-label use? I'll I'll address that question. So we're definitely not going to talk about off-label use, unfortunately, here today. But
I,
any technology, you what?
I have some stories.
You have some stories. We won't talk about off-label here today, just for compliance purposes. But of course, just like with any medical technology that you could use, of course, there's off-label uses. Um, we don't necessarily promote those uses, but as a medical professional, depending on your state and your local regulations, you can use technology and explore in your own regard. With regard to the mechanism of action, at a high level, it's very simple. I'll give you a high level overview, which is the technology works through a process known as mechanotransduction, which is the conversion of mechanical stimulus into biochemical signals. So if you think about the StemWave machine, you've probably seen it before you came to the call. Imagine the applicator head over my shoulder right here. We're sending waves that are moving at over 3,500 miles per hour, breaking the sound wave barrier. And that mechanical energy is then converted into biochemical signals. Those biochemical signals are regenerative and positive biochemical signals. We've designed the technology to move at a frequency, energy, and power that creates really all the positive biological responses that we would want to happen. And so that's essentially what the mechanism of action is. Um,
I add one thing.
you can add two things if you want.
So we were not using this as off-label, but sometimes when you're treating an area, you end up with some very exciting side benefits. And we have had people with kidney stones that had low back issues, and we weren't treating the kidney stones, we were treating the low back, and it has either broken them up or caused them to pass those kidney stones. So
Wow.
it wasn't our intention, but it was just kind of something that ended up happening. And I've heard that, that kind of therapy can do things like that. So,
Yeah, I mean that's initially how the technology was designed in the first place for lithotripsy.
yep.
Um, okay, are acupuncturists authorized to use this? This is from a technical standpoint. Generally speaking, this is a local, state, and regulation question more than it is like a federal question. So, Ron, this kind of just depends on where you're located. If the question was, do we have acupuncturists who use the technology? The answer is yes. It just depends on a lot of different variables. And so, Ron, the best thing you could do to find out if your office and your staff would qualify for this is just to go to our website, book a call with our team, and whoever you speak to, they'll just walk you through exactly what the details are based on your local state and regulations, and they'll set you up with all the details. We got a question from Jennifer. I came in a few minutes late. However, I'm very interested. I don't understand what this is, if it's laser, if it's ultrasound. I think I missed that part. I'm an acupuncturist and I need this in my practice. How do we describe to Jennifer what this technology is, Lynnette?
It is basically a sound wave. It's a deep therapy that causes the body to generate stem cells to heal damaged tissue.
That's essentially what it is, right? It's an acoustic wave technology. Jennifer, it uses something, we kind of took that category of medicine, we redesigned it with something that we define as cellular response technology. which is really just a new and completely updated version of that, which is StemWave. So if you want to learn more about that, Jennifer, you can go to our website, book a call directly with us, and we'll answer one more question, then we'll have to get out of here, which the question is, can it be used on the face? We do not advise for it to be used in the face. Primary reason for that is it goes anywhere from 7 to 12 centimeters deep into the tissue. What's 7 to 12 centimeters behind your face? You guys know the answer to that, right? So with that, I'll give one final piece of advice and then we'll close up here, which is if you're on the call, whether you're listening to this on Facebook, whether you're listening to this on Zoom, wherever you are, I want to thank you a ton for coming. And I want to give you something, which is if you're considering this technology and you're looking into this and you're wondering if your community could benefit from this, we'd love to help you. And we'd love to find out if we can help your community. Anybody who would like to try this technology, our offer is simple. We'll place the technology into your office. If it doesn't profitably add $5,000 to $25,000 a month to your clinic, while also getting incredible patient results for you, like the ones that Dr. Hendrickson talked about here today, if it doesn't do all of that, you don't have to keep it and you don't have to pay. We've done it with 450 offices in the last 24 months. And we've had a 98% success rate this far. The machine does a lot of the heavy lifting, but our team is also pretty good. So it's been a really good process. And if that sounds interesting for you, the best thing you can do is just go to stemwave.com. You can go to stemwave.com, just click book a call with our team directly in the right-hand corner. And yeah, we'll be happy to speak with you. And with that, Dr. Hendrickson, I also just want to thank you so much for coming today. Your story about your family and your son is incredible. It's a wonderful introduction to our technology. And what you've done with it is super inspiring for me. It inspires our team. And this is like, this is like what we do this whole business for. So thank you so much.
Thank you.
Amazing. Well, have a wonderful weekend, everybody. And we'll talk again soon. Bye.